evening to all my students, especially for the human factor engineering. So today, this week, we learn about the new topics. So we are going to learn about the CTD. CTD. Okay, cumulative trauma disorder. Okay, so this is one of the topics, a new topic for our chapter in our subjects, especially for the human factor engineering. Okay, so CTD. Some of the country in other country they stated that cumulative trauma disorder. We call it as a CTD. Some the others countries such as UK, US, and other European country, they call it as a musculoskeletal disorder. Can you spell it? Cuba sebutkan. Musculoskeletal disorder or MSD. Okay.
Musculoskeletal disorder.
Some noun pronunciation from the our France lah, Spanish lah. So in Malaysian word, musculoskeletal disorder or MSD. Okay, there are two type of MSD or we call it as CTD. The first one we call it as a ATD. ATD stand for acute trauma disorder. Second one we call it as a cumulative trauma disorder. ATD, CTD. Not OTD not OTD is different tu kalau OTD tu budak-budak IG lah different. Okay, what is the ATD? Acute trauma disorder or ATD. So ATD is injuries which occur instantaneously due to non-cause. So injury can be accidental or intentional. Example, act of violence caused by blunt or sharp objects, bicycle or motor vehicle accidents, fall and impacts, animal insect bites, burns, example for a thermal, chemical, electrical, sport, and athletic injuries. So you can prevent, okay, or reduce the risk many of ATD injuries by following basic safety precaution. So I repeat again, ATD, acute trauma disorder, is occur instantly due to non-causes. Okay. Meanwhile, for the cumulative trauma disorder, CTD. CTD are health disorder arising from repeated biomechanical stress. What is a biomechanical stress or biomechanical risk factor? Including awkward posture, repetition motions, forceful exertion, carry heavy manual handlings, for example. And CTD involve damage to tendon sheath, related bone, muscle, nerve, example, hand, wrist, elbow, shoulder, neck, and also the backs. So this is arising from repeated biomechanical stress or biomechanical or ergonomic risk factor or physical risk factor related in the workplace. Okay. And what are CTD? Okay, in definition, injuries of musculoskeletal and nervous system. So that may be caused by, as I mentioned earlier, this is an ergonomic risk factor or physical ergonomic risk factor. Repetitive tasks, forceful exertions, vibration, mechanical compression, bracing hard surface or edge surface, or sustain on awkward posture. So all these things can cause of the cumulative trauma disorder or MSD. And also called regional musculoskeletal disorder. Some of the other country, they call it as a repetitive motion disorder, RMDS, or overuse syndrome, or repetitive motion injuries, RMI, and R repetitive strain injuries, RSI. In Malaysia, we are follow in WHO. Okay, so we call it as a musculoskeletal disorder. So ergonomic is related, physical ergonomic is related to the musculoskeletal injuries or musculoskeletal disorder. Okay. So what are CTD? This painful and sometimes crippling disorder develop gradually over a period of the weeks. months, or years. So they include following disorder which might be seen in office work or industrial works. For example, if you are performing, okay, prolonged sitting at works. Okay, you sitting in chair here. Okay, in front of you is computer or laptops here, and then for prolonged might be more than 2 hours total per day can cause some of the injuries. What type of injuries? Uh, Such as this carpal tunnel syndrome. Carpal tunnel syndrome. Due to repetitive work and unknown awkward posture by on the wrist hand. Also, the another MSD injuries include lower back pain, LBP, uh, because due to prolonged standing or prolonged sitting at work with improper posture. Okay, for example. So this is for the office work. For the industry work, industry work might be exposed to the ergonomic factor due to manual handling. Ah, Carry the heavy loads. For example, let's say this heavy load 60 kg, and then bending posture can cause of the also LBP, lower back pain, due to frequency, intensity, and also duration. Okay, this is example. The workers exposed to the cumulative trauma disorder. Okay, so we look at on the another slides. Okay, frequently occurring occupational induced MSD. This is the list of the MSD injuries. Okay, when you are going to the hospital, you see a doctor or HD doctor, occupational health doctor. So you might be seen or heard any this word, carpal tunnel syndrome, CTS. Okay, and tendinitis, tenosynovitis, inflammation of lubricating fluid of the joints. Stenosis, tenosynovitis of fingers, lower back pain, shoulder pain. So there are many types of the pain. Shoulder pain, neck pain, or neck injuries, rotator cuff pain, and the others regarding to the our musculoskeletal disorder. And for example, this is carpal tunnel syndrome. Okay, we look at what is carpal tunnel syndrome, CTS. Carpal tunnel syndrome is a compression of median nerve. Okay, so please look at carefully. Where is the median nerve? This is median nerve. Okay, in the wrist that may cause by swelling and irritation of tendon and tendon sheath. So flexor tendon here. Transverse carpal ligament also will be here because of compression. On might be on the hard surface, edge surface, can cause of the carpal tunnel syndrome due to the workstation, work task. Meanwhile, for tendinitis and inflammation, swelling or irritation of tendon develop when the tendon is repeatedly tense from overuse. An unaccustomed use of the hand, wrist, arm, and the shoulder. So this is like this example of tendinitis. Okay, due to we overuse the tendon repeatedly. We are doing a same motion by using a same muscle tendon and again. Okay. Uh, and low back pain is the most common type, MSD injury, and relate to the manual handling activities. So this include a pull or strain muscles, ligament, tendon, ruptured disc. So they may cause by cumulative effect of faulty body mechanics, poor posture, or improper lifting technique. Okay, for example, if you are here lifting like this in bending posture, okay, So suddenly can cause of the lower back pain, LBP. Okay, let's say this walk is 80 kg. Okay, so you have to repeated same motion with repeated accord posture in bending posture. Let's say 145 times bending per day. So it can cause of the lower back pain. So it based on what? Intensity, okay, frequency, and also the duration. So please remember, okay. This is where there's a lower back pain. Sometimes, okay, in other cases, they are going to upper or neck. This is neck injuries. This is upper. You upper, okay, back disorder, UBP, or this one is a middle. So it based on the cases. Okay, upper, lower, at the middle. So it based on the categories. So basically, lower back pain is come from L5, S1, a problem, or okay, L5, L4. So between we want to look at a condition of our disc bulge, whether it's bulgings, whether it's herniated, and the other problems mentioned. And the other thing, epicollitis, elbow pain, associated with the extreme rotation forearm, bending of the wrist. The condition is called tennis elbow or golf elbow, or we call it a thrombotic outlet syndrome, TOS. TOS, thrombotic outlet syndrome, is compression of nerve and blood vessel between a first rib, clavicle, collarbone, and accompanying muscle as they lift their throat, chest, enter the shoulder. This is thrombotic outlet syndrome. And the other thing, cervical radiculopectory, a compression of nerve root in the neck, okay, cervical, and ulnar nerve entrapment, a compression of the ulnar nerve in the wrist. So there are many things, okay, example regarding to the our cumulative trauma disorder or musculoskeletal disorder. So what are the symptoms of CTD or MSD? It can be numbness, okay, decrease a joint motions, decrease of the range of the motion. We call it as the ROM, range of the motions, swelling, burning, pain, weaknesses, redness, clumsiness, tingling, cracking, a popping of the joints, or itching. Okay, this is a list of the symptom, general symptom of the cumulative trauma disorder. And what are the symptoms of CTD? Symptoms may involve the upper and also the lower back, shoulder, elbow, wrist, or fingers. If the symptom lasts for at least 1 week, of if they occur of many occasions, a doctor should be consult. Okay, so you can see, you have any pain here, any sign symptom has been listed here. So please see a doctor for further detailed assessment. Okay, MSD risk factor. Musculoskeletal disorder risk factor can be classified into two categories: non-work related and also work related. Work related is more on occupational risk. Okay, so what is a non-work related? Okay, please remember each of individual, okay, they have their own characteristics. Okay, for example, is it relate to the non-work related or work related to this job? Okay, for example, non-work related including pregnancy. Okay, pregnancy, the number one. Number two is if he or she have a previous injury due to accidents. And look at the hobby. Playing, for example, rugby. Playing rugby can cause more damage to the versus to the normal person in office workstation, for example. So rugby versus office workstation. So hobby for the rugby can tend to the injuries Example for the necks, for the hand or wrist, back, because this is extreme sports. Okay. Number 4, medication taken. Look at on the previous history, employment. Okay, medical. Okay, is it any history related to medical and current previous disease, illnesses verified by medical practitioners? Okay, this is number 5. And number 6 is congenital anomalies related to the MSD. Okay, so this is, we call it, is classified as a non-work related. So all these things is based on the individually. Meanwhile, for the work related is more on the risk workplace. Whether we are working as the cashier, for example. Okay. Siapa tu tak mute tu suara? Tolong mute suara, please. Cashier, for example. This is work related. Prolonged standing at work. Siapa lagi tu? Prolonged standing at work. Okay. Okay, for example, prolonged standing at work can cause of the varicose vein, for example, or lower back pain, improper posture, for example. This is more on work related. If you are working as a material handler, okay, lifting the heavy transportation material handler at the courier services, for example, can cause of the work related. Okay, so what is a work related? We want to relate. Okay, so we want to look at on the exposure duration, as I mentioned earlier. So duration, we want to look at on intensity, okay, frequency, and also the duration factors. And this is based on workplace layout. We want to look at the behavior of the job design, whether design for the sitting or sitting standings above, okay, whether it's standing or sittings. And the most important thing is ergonomic risk factor. We call it ERF. Okay, so ERF stands for the ergonomic risk factor. So including awkward posture, static position or sustained posture, forceful exertion, repetitive motions or movement, vibration, and environmental risk factor. So we look at on detail each by one. Okay. Okay, this is ergonomic risk factor. Ergonomic risk factor apply everywhere where there is a human activity as is involved. Whether you working as a mopping the floor, for example, they are still have a risk factor here. What are the risk factor include? Might be a awkward posture. Okay, for example, mopping here. Okay, awkward posture such as bending posture, plus heavy load to carry, forceful exertion. Okay, awkward posture first, forceful exertions, FE. Another thing is repetition motion. Repeated at the same time. Repetition motion. This is the list of the ergonomic risk factor might be found in human activity when in performing their work tasks. So example, at work, home, school, cooking, driving. Even though we driving, sitting in the car, also they have a potential risk ergonomics. For example, awkward posture, improper back posture, okay, repetition, okay, and the other things. And this is ergonomic factor, workload required, and worker capabilities. So we want to look at the force or retention, frequency, and also the motion. Same goes to be the workload requirement and workload capabilities. Whether the force, orientation, frequency, and also the motion. Overload? No or yes? If yes, we proceed to ergonomic risk factor for the assessment. If no, accept no. So we want to determine whether is it over a limit, okay, based on our individual factors. Okay, this is the list of the ergonomic risk factor. Okay, please remember in our certified ergonomic train person, in order to assess the initial ergonomic assessment, so we must assess the generally physical ergonomic risk factor, or we call it as the ergonomic risk factor. Okay, this is the thing. Okay, acquired posture, static position or sustained posture, forceful exertion, repetitive motion, vibration, and also the environmental risk factor, including lighting, extreme temperature, ventilation, and also the noise. Okay, we look at detail one by one. Okay, so what is acquired posture? Position of the body part that divide significantly from natural working posture while performing a task. For example, bending posture. This is bending posture. Reaching posture. Reaching posture over a shoulder. And then back twisting. Back twisting. Okay, this is one of the awkward posture. This acute posture increase stress on the joint, increase the musculoskeletal efforts, reduce strength, lead to the faster fatigue rate, and cannot sustain for the longer period. So may cause acute and also the chronic injuries, tear of the muscle, tendon, and also ligament over a time. So what is the difference between acute and chronics? Acute less than 3 months. Chronic injuries is more than 3 months. So the durations. So the worst is combination with forceful exertion. If acute posture plus forceful exertion and plus high repetition with long duration can increase the MSD risk. For example, I give it to you here. Okay, this is acute posture. Okay, and then carry the heavy lifting, red color. Forceful exertion here, high repetitive motion with long duration. Let's say this worker need to repeat 345 times to lift the heavy box per day. So with more than 2 hours per day or totally 6 hours total per day can increase the MSD risk. Okay. Meanwhile, for the static position and sustained work posture, a fixed position with minimal movement of the particular body. So at least 10 minutes or more static posture. For example, prolonged standing at work. Okay, while performing works. Or prolonged sitting at works. More than 10 minutes. It promotes a fatigue, discomfort due to lack of blood circulation due to our sustained work posture. So likely to cause irritation, inflammation, strain, and worse if combination with poor posture, contact stress, and also the long duration. Okay, this is what you call it a static position and static position and sustained work posture. Meanwhile, for the forceful exertion, forceful exertion. Forceful exertion is a high force exerted by musculoskeletal system, example, muscle, ligament, tendon, and joint, to match the required task workload. So the forceful exertion is based on number one is specific body part and type of the muscle used. Okay, this is number one. Number two, we want to based on the individual strength capabilities. They might be different male and females, which in theoretical male must more strength capabilities compared with the females. Okay, uh, and likelihood to cause irritation, inflammation, and strain and acute or chronic injuries. Okay, this is number three. And number four, worse if combination is high acceleration or speed, vibration, poor posture, high repetitive, and long duration. And last but not least, forceful exertion also based on cannot sustain for the longer period. This is what we call it a forceful exertion. So forceful exertion is more on material manual handling, MMH. So what is the MMH include? Okay, activity include lifting, Uh, Lowering. Okay. Pushing. Pulling. Uh, okay. Lifting, lowering, carrying the heavy load. So this is called it as a forceful exertions. Meanwhile, the repetitive motion. What is repetitive motion? Repeated movement of the same group of body joint and muscle too frequent, too quickly, and over a long duration. So such as performing a task over and over again with a little variation for the several hours using same muscle, same tendon in the same way. So worse if the leg recovery within a cycle. Worse if the involves some type of the muscle. And if worse if involves smaller group of muscles such as a wrist and also the finger. So can you give me example a job task that need to repetitive motion? Can you give me what a task similarly have the exposed to the repetitive motion?
Operator.
Operator performing what? What the task?
Part assembly.
Part assembly, repeating over and over using a same muscle, tendon, ligament, whether the right or left hand, and mostly contribute to the upper back, okay, and upper body regions, okay. And vibration. Repeated exposure to the high level of vibration can cause injury to the workers. So there are two type level of the vibration. We call it as a HAV. HAV is stand for hand arm vibration. Okay. And number two, whole body vibration, WBV. So HAV exposed is non-contributing factor to the carpal tunnel syndrome. Cause direct injury to the finger, hand, also affected feeling, dexterity, and also the gripping factors. Meanwhile, for the whole body vibration is contributing factor to the higher level of the lower back pain. So in the workforce and causes of the lost time and production output. Okay. So this is HAV, hand arm vibration. Such as you are using the hand tool grinder, okay, impact gun, machine, saw wheel machine, gun, and such the others. Okay. Whole body vibration, when you are using whole body is using, for example, using a forklift, okay, vibrating all the body, whole body has been vibrating. Okay, they call it a whole body vibration, WBV. And example last is the environmental factors. It's about the lighting, extreme temperature, ventilation, noise that directly, indirectly affect a worker behavior. So this example, too hot and too humid, extreme temperature can cause of the ergonomic or musculoskeletal disorder. Dim lighting also, noisy and others. Okay, this is an example when we conduct or assess the environmental factor, especially for the lighting, temperature, ventilation, and also the noise. And how we want to CTD treated to prevent the cause, sign, symptom related to MSD. So the best treatment for the CTD is the rest. Please remember, the best treatment for the cumulative trauma disorder is we need to rest from the activity that cause of the problem. Or we can changing in work practice. So we have to modify the work practice. We want to modify the SOP, standard of procedure, and the other things. It's very important that doctor has been seen as soon as earliest symptom of CTD has been recognized. If you out there, if you have experience regarding to sign symptom related to musculoskeletal disorder, for example, numbness in your hand wrist, whether the right side or left side, so please do treatment. Please see the doctor for further detailed assessment. And this is because treatment is more successful if the disorder is diagnosed earlier. We want to prevent earlier. Okay. And the doctor may send the patient to another doctor who have specialized in the nervous system, neurologist, musculoskeletal treatment, okay, physical medicine, rehabilitation for further tests and also the treatment. Okay, and then medical treatment will vary for each type of CTD. For example, okay, medical treatment include wrist splint. What is a wrist splint? This is our hand here. We also have the splint here. Okay, it's such as a glove lah, or splint to keep wrist from the bending. Cold and hot bath. Eh? Anti-inflammatory medication. Steroid injections. Physical and occupational therapy. Occupational therapy, OT. Or you want to physical therapy, PT. Okay. And surgery in advanced cases is not recommended if the advanced cases. Okay. And very important to remember that each individual for the each injury is very different. Uh, okay, that's all for the class today. Any questions so far?